for the introduction. Thank you, the University of Houston, my home institution, for co-sponsoring this event. Thank you to everyone who are participating. And thank you so much to our brilliant panelists that I get to be in conversation with today about critical feminism and anti-Blackness and the implications for social work. Before I begin, I'll briefly introduce myself. I'm Quenette Walton again, an assistant professor at the University of Houston in the Graduate College of Social Work. I do qualitative research specifically on middle-class Black women, looking at issues related to depression, right, and wellness and well-being, using intersectionality. I can go on and on about my work, but I'm not going to do that. I'm delighted, I cannot say enough about our panelists today, to be able to be in conversation with them about the work that they do, the impact that they're having in the field and in their communities. But before I begin, let me just tell you what our agenda is for today, or for our time together. I will introduce our panelists and then give them a time to just a brief couple minutes to say anything else they'd like to add about themselves. Then we will dive into our conversation for maybe about 40 minutes or so, and then move into some Q&A and then have our closing remarks. We're looking forward to this conversation, but before I begin, let me introduce Dr. Kelly Jackson. Dr. Jackson is an associate professor in the School of Social Work at Arizona State University. Her research examines the identity development and overall well-being of persons of mixed race heritage. Dr. Jackson is co-author of the book Multiracial Cultural Attunement by NASW, which introduces a critical and anti-racist model of practice for helping professionals serving multiracial individuals and families. She is a mixed Black and cisgender woman who resides in Phoenix, Arizona, and she lives with her daughter, partner, and pup. Did I miss anything, Dr. Jackson?
No, the pup is outside, so hopefully we all don't have to hear him barking. So thank you so much, Dr. Walton. That was a wonderful introduction.
Of course. Our other panelist is Ms. Charla Yearwood. Charla is the founder and clinical director of Connected in Community, a therapy practice in Indianapolis. Charla is all about liberation, social justice, and community. She believes we are all connected in, by, and through community, meaning our healing is tied together. Her professional work is rooted in Black liberation and abolition. Charla's research interests include liberation-based clinical mental health care and other topics related to diversity, equity, and inclusion. Outside of work, Charla and her husband have 2 children, 2 dogs, and a cat. As a family, they enjoy a good sing-along. I miss anything, Charla? Oh, can you not unmute yourself? Oh.
I don't know, everything froze up for just a second, so thank you.
No worries.
I'm here.
Hi. So let's begin and just tell us about the work you do and why is it important now more than ever?
Yeah, so the work that I do, I'm still trying to figure that out all the time. Like what is this work that I'm doing? In some ways, I think the work that I'm doing is social work as I first understood it. And so I'm doing the work of social work, again, as I understood it to be this multidimensional practice of helping to respond to the some of the oppression and the pains of our society at multiple levels. So that's the work that I'm doing. Sorry, there was an extra piece to that question.
Yeah. Why is it important now? Because before you answer that, Charla, I think you're underserving the work that you do and what you have been doing. So if you can talk a little bit more about that in relation to our topic today, that would be very important because you do more than that. So don't be shy, please don't.
Okay. So I think that what's hard for me to bring together when I do this work and why I feel so shy about it is because to those folks who are on the call who are like, I'm just a clinician or I just plan to do a certain thing, like that was very much my path. So I feel a little bit hesitant to talk about it really boldly, because what I do is that I understood practice to be something. I look to build a practice that was centered on those ideas, and then I also talk about them. And that has led to some continuing education and conversations and things like that. So I have this practice, Connected in Community, here in Indianapolis, and some core differences about my private practice compared to other ones are that it is rooted and foundationally in serving those folks who are most marginalized in our community. What I mean by that is, like, when I'm picking out the furniture, I'm looking at what is the weight limit on that furniture. Like, I am intentional about thinking about who is going to be coming into this space and how I can make sure that it's a place where they can feel comfortable and supported, and their needs are going to be met. So there is art on the walls of multiracial coalitions of people. I have a hanger, a wire hanger art piece to represent abortion in my lobby. It is centered, it is created to be centered on ideas so that everyone can feel like they can be included and that there's space for them here in this space. And then also how I've expanded as a group practice, we operate more like a co-op. So again, still trying to just actively dismantle and tear apart these ideas about what business has to look like, what practice has to look like, and bringing that into our work. So in challenging all those ideas and talking about all those things, it has led to continuing education. It has led to writing and talking about the ways that white supremacy shows up in social work practice. But all of that doesn't feel like such a thing for me all the time, because it's just what I always understood social work practice to be.
Thank you. That's what I was looking for. I don't need you to be shy in this space. Dr. Jackson, tell us about your work.
Thank you. And I'm so glad you followed up with Charla about hitting on some more of those points. I think many folks who joined us today are aware and listened to her podcast, Doing the Work, where they're talking about the licensure exam and really looking at anti-Blackness and systemic racism in that process. So you are doing the work and much appreciated. As far as kind of, what I've been doing and what I've been doing recently, I think for a long time, and I've been in academia since, getting my PhD in 2007 and prior to that. So I think I've always just, been the person kind of speaking out about issues of racism, particularly in academia. And, a lot of folks looking at me aren't assuming that that's a priority or a concern, based on my appearance, based on my mixed Black and white heritage. And, so I think for me, my work is always kind of raising us to critically think about race. When we think about identity, how we incorporate and acknowledge the nuances that are related to how we identify differently and how we experience culture differently. So really wanting to kind of push our profession past this really essentialized notion about race. And we think about particularly anti-Blackness, I think, moving and challenging my own field, my own area in terms of looking at mixed race identity, which is very much steeped in anti-Blackness, is, really trying to challenge us to look more kind of critically at that, to dismantle it, to acknowledge it, to name it. So I see my work more recently in just using my own privilege as a tenured professor to focus on the voices of Black women and mixed Black women, particularly PhD students and assistant professors, to be able to tell our stories and have that showcased in an article. So I think for me, really, it's just been more about using this opportunity, I think, in our society right now. I wouldn't necessarily call it a reckoning, but more of, folks are more open to us saying, systemic racism, not necessarily anti-Blackness, but using this as an opportunity to kind of kick that door down and allow our stories to be told.
Thank you for sharing that. And thank you, Charlotte, as well. I want to also just acknowledge that we had a third panelist who was supposed to be with us today, but had a family emergency, and their brilliance will definitely be missed in this space. But I want to acknowledge Dr. Nicole Corley for her contributions, not only to the field of social work, but to Black mothers and challenging our understanding of anti-Blackness through motherhood and using qualitative methods. And so please read up on her work. It's available to you in the chat as open access. So wanted to let you know that she was supposed to be a part of this conversation, but due to family issues have not been able to join us. So let's continue to move on as well with our two current panelists and help us understand, given what the work that you do and how you do it, why is it important for the field of social work to address issues related to anti-Blackness now?
Here's what I can say about my own understanding and how I've come to understand white supremacy in action in social work. I'll admit that when I first came to social work, I was really idealist. Like, I did not recognize all of the white supremacy in the institution from the beginning. I actually came to social work in large part because I loved seeing some of the things that I was passionate about, what I thought were really clear, and like code of ethics, and I thought that those were really speaking to ideas that and values that I also shared. And I do think that that's true. But the closer and more I began to engage with social work, I saw it have some areas of problem. And when I tried to have those conversations, I very quickly realized, like, oh, we aren't all in this in the same ways that I first came to it and thought that we were in it. And so I think for many reasons, social work needs to do some evaluation. I would say it needs to do some evaluation, and this work is important right now because social work needs to understand, just at a capitalistic level, culture is changing and shifting, and social work is behind. And I think it got really comfortable at being progressive at some point. Social work is not progressive right now. And so at a very basic, I don't know how long the profession can just endure a cultural shift. And if it's not propelling and pushing things forward, I think we're behind with where just conversations are happening on TikTok are more progressive than conversations happening in our classrooms. So in that way, I think it needs to change. It also needs to change because it's causing harm in the community, a growing harm. And, we are in this game of eventually there will have to be some reckoning. Like, people will get upset, like, there's a rumble of things, but things are going to change. And I think social work needs to do some evaluation of where it fits in that movement. And then we also need to do some evaluation of where we personally sit in that movement, personally and professionally. And a lot of us are setting ourselves up. We're not on the right side of where history is going.
Yeah. Let me ask a follow-up, Charla, before Dr. Jackson, you answer. What you talked about areas of problems for social work, given that question. Can you give some examples of what those areas are, that
so
maybe inside and outside the classroom?
Absolutely. So here's a really small example. And I think we just need to be conscious about when we hear rumbles in the community. What are they actually like? Instead of just being like, oh, we don't agree with that. That's not how that, just like dismissing it. I think sometimes it's really important to listen to what it's actually saying. So when things started happening at the border, kids were in cages, all of those conversations, real issues, appropriate conversations, things that should be talked about. There's also a recognition of, like, those are social workers down there placing children in different situations. And what does that mean in relationship to what we've always known the child welfare system to be? How are we actively harming and hurting and perpetuating problems in community? Are we acting as the police? Like, I think that there's some real questions that came up. And instead of doing the difficult work of wrestling and thinking about where we actually fit in there, what we want to be okay with, what is not okay, how we want to practice, our institutions are instead like, no, like that we have diversity of how different people can practice, and like we can't say that and be, have these values that are rooted in social justice. We can't. We need to be asking ourselves, who are we? Where are we in position with the people of the community? Are we agents of the state? Are we part of the community? Where do we lie? How is our practice rolling? Are we continuing to diagnose and play into a medical model and looking to connect with insurance and licensing? And is that the path that we want to go down? Or are we more of holistic care and we don't want to participate in the larger structures of those systems because we recognize how they can be oppressive? I don't know that social work is asking those big questions.
Yeah.
We're just chugging along at like getting students in the classroom, graduating, getting licensed, going and having a practice in community mental health. Like, okay, that'll work for a time, but things are moving larger systemically. And I don't know that our profession as a whole is keeping up with that transition, going with that transition. And it's a divide is showing. The cracks are starting to show.
And the consequences of that, right? In many ways, within the classroom and without, like outside of the classroom, and what students expect in their practicums or field placements or internships, whatever language that they use, and then what they bring with them, right? Like when we talk about intersectionality, when we talk about being critical feminist, what does that look like in practice? But then not everyone can teach it, right? And so we have to think about that. So problems. Go ahead.
Yes, those problems show at multiple levels. Those problems show at who's applying to the program, who's getting in the program, what courses are being designed, what courses are not being designed, who's teaching, how they're teaching it, then what is being tested for licensure, what's not, what is good practice, what is not. And there's dangers in that, right? Because if some of us go out and we practice separately than what the data and the research is saying, and what the social work institutions are putting out as evidence-based, then we are putting ourselves out into the wilderness of where we could possibly get harmed. Like there's real things that go along with it. I'm concerned. I have a growing concern for where our profession is. And so I personally push on the wall a little bit to see like, where are we actually at? Where are we going to be, in part so I can figure out my own practice? Will I always be a social worker? Is that always how I want to practice? Is the profession staying in line with the values that I hold? Some of this is figuring out, where do I personally lie, and also building community in that space. Because I don't know if we're all on the same project.
Yeah, and with the growing diversity, right? Like there are more issues that we have to address when we, just given the topic that we're exploring around anti-Blackness, right? Some folks wrestle with the term, like, do I say Black? Do I say African-American, right? Like, what do I say, right? So the struggle around that, just around language and engagement around that in the classroom. And if we say racist, something racist or discomfort or uncomfortable, right, they were gonna label me racist. And so not necessarily balancing that in some ways, but how do we fully address it to have the programs or the schools or the field shift in a way that can address the needs, maybe not all, but most of the needs that are arising. Dr. Jackson, your thoughts. Why is it important for the field of social work to address issues related to Blackness and anti-Blackness now?
Well, I just want to build on, the conversation you both just, talked about in terms of, our profession. I'm not convinced that we ever were the things that are written in, the NASW Code of Ethics, and that we've ever been built on a foundation that wasn't infused with anti-Blackness, that wasn't infused with white supremacy. Something that came out in that podcast I referred to with Ms. Yearwood was the idea that, social work was built on white saviorism. So in many ways, asking the profession to shift or to move in a direction that, it was never designed to do, in some ways is impossible. And I think for many of us who have been in our schools, who have been in academia, who have been in practice, who have interfaced with, social work, academia in general, professional development, have known this, because we've been fighting these battles.
That's right.
And I think that's something that, we have to acknowledge, is this idea that, we've been trying to educate white folks out of racism for, over 400 years. It doesn't work. Yet we're still trying. And with tokenism and, being one of, maybe a few, or the sole Black woman within your school, you have the burden of trying to eliminate anti-Blackness from your school. Again, that is a very kind of, if you think about it, white supremacist view, come and solve our problem for us, be in service of us. So I think when I heard Charla, talking about this and knowing that we're behind, we've always been behind. We're not allowing folks to the table. Folks in power are not willing to give up power. So I think, and that controls the curriculum, that controls how we're educating our students. So again, I'm just always left kind of really thinking about that.
Yeah, I think one thing you're making me think of is the conversation that I have with my students on a regular basis in order for them to see change. And I always ask them, what are you willing to give up, right? What narrative are you willing to change to do something different?
Exactly.
Right? So when I think about the work I do, in particular for middle-class Black women with depression, I don't want to hear about the deficit. I tell them, don't tell me what's wrong, tell me what you've done right. Because you were getting something done all along before I even got here. So you've done something right. And we are missing the opportunity to build, to collaborate, to advocate for what you need. Folks will tell you what you need, what they need. We've been saying it all along in these spaces. No one's listening.
No one's
right?
listening.
No one's listening. I think I interrupted you, Dr. Jackson, when you said you were about to say something else.
No, I'm just literally repeating and affirming exactly what you said. No one is listening, because we've been saying this for a very long time. And when you particularly look at the disparities research, they're real quick to point out, how Black women are experiencing more mental and physical health problems, but those same articles are writing in a way that blames Black women for these problems, pointing out, oh, is this a genetic issue? Is this, because of, different stereotypes around being a Black woman, that it's all of a sudden your fault for having these experiences. And this research is celebrated. I mean, we got conferences that are like, let's talk about disparities research, scholarships, all this stuff. But how we're talking about it and how we're kind of centering the research is not on Black women. It's still normalizing whiteness and looking at us as, again, some, object that lacks kind of humanity to be able to really, have these experiences. So it's
more individual, right? And when you think about Black folks, we're collective.
That's right.
In many ways, right? We're communal. And our interventions and our approaches oftentimes miss those opportunities to really build and to create change, right? And to offer a different narrative of what it means to be Black in America, right? To offer a different narrative about what it means to heal, to offer a different narrative about how we use spaces to educate others, right?
Dr. Walton, I gotta say, and I don't mean to interrupt you, but your article, I know you're talking, you guys are all talking about our stuff and our articles or whatever, your own article, which offers a strength-based intersectional framework and thinking about Black women's mental health is exactly what we need to be able to kind of push, challenge the profession to do exactly what it says it's gonna do. So I think that's, so important, that idea of representation in the literature. And I think that's something that Ms. Yearwood, you did with having that special issue that's really pointing out, we need to talk about white supremacy and what we're going to do systemically as a profession to address it.
That's right. Well, this is making me think about other challenges, right? When we think about field practicums, when we think about the ways in which who becomes field placements or field practicums, who become instructors, right? What does that mean in terms of how do we support their education around being able to talk with our students about this? It also makes me think about it in the context of how we require, right, someone on staff to be an LCSW, but then miss the opportunity and understanding around the ways in which the exam has marginalized in many ways people, right? Like, so in many ways, we're reliant on a field that has been anti-Black for decades, for centuries, right? To educate and put Black folks in some ways at the center to help create change, but then the labor becomes, right? Like it's this cycle in many ways that we struggle with. And so like thinking about your work that you've been doing, not just the articles that we're highlighting and talking about today, but like, how would you think, or how does your work, right, contribute to some of the changes we need to dismantle the struggles that we're having with white supremacy and anti-Blackness? And I'm talking about work like broadly, right? Whether it's practice, whether it's research, whether it's community, because we know as educators and practitioners and as folks of color, and particularly Black women, our work is multifaceted. We're not just doing research. We're not just doing teaching. We're not just doing right service. Our work is a multitude of things. And so talk to us about what that will look like for dismantling that in these systems. Or in
So
this
yeah. So in this system, I will do the work of helping white folks unpack their racism and heal from the internalized trauma that they then push out against everyone else and force everyone else to live through the consequences of. I will help white folks heal from that for a fee. That is part of my own way that I push back on all of the system. I'm not doing that work for fun or as a side thing. I am focused on supporting and helping marginalized folks who have to deal with the consequences of the oppression, navigate the existence and the realities of this world other than what I do for hire. And that is in part a way that I am purposefully positioning myself in a way that says like, yes, I'm willing to do that work and help, and there is a need there. That need is for a healing amongst people who believe in the lies of white supremacy, believe in the lies of patriarchy, believe in the lies of ableism, and then use those beliefs to cause harm to others. And I will help with the work of dismantling that in a way that is affirming for myself, because that work is not necessarily my work inherently. And so like that is one way that I have been really intentional about pushing back and doing that. You spoke earlier, like because of your research, Dr. Walton, is with depression and mental health. I think another way that I didn't always understand was how much practice is interwoven into this work. And as somebody, I studied macro. I was like a macro social justice social worker who now has like private practice and does clinical work all the time. But I had to come to an understanding of how much hate is interwoven with pain,
Yes.
how much healing is also and liberation are tied together. And as I understood those things, then it changed the way I practice clinically. And so I'm really intentional in my practice to name power, to name privilege, to talk about those things in relationship to people's healing journeys, because they are so connected, and that connection wasn't made for me in social work school. Those are things I had to learn in the community.
What about you, Dr. Jackson? How does your work contribute to the changes needed in the field to dismantle, right, white supremacy and anti-Blackness?
Dr. Walton, I was just thinking of our prep meeting where we talked about look, I don't expect it to. All right.
Yeah,
So to be completely honest, I think when I approached this work and this project with my co-authors and colleagues, so Drs. Obanaya, Mitchell, Crudup, and soon to be Drs. Mackey and Turnlin Carver, you know, we weren't writing this for the profession, or we weren't writing this so that schools of social work could, take notes, or white administrators make some changes based on what we said. We don't expect that to happen. It hasn't happened because Black women have been writing about this topic for, decades. And, again, seeing the level of change related to that. So I think for us, when we approached this, it was really about ourselves.
That's right.
So really being able to take a closer, critical, vulnerable kind of look at a phenomenon that still wasn't being named, even as, this reckoning is occurring. And all these statements are coming out about systemic racism and social workers against systemic racism. No one's mentioning anti-Black racism. No one's saying anti-Blackness. So I think for us, we were feeling again, like we've been feeling in this profession since the jump, left out, otherized, people weren't concerned. So I think creating these counter spaces for us to come together and be able to talk about our experiences and noting the differences in our experience related to our positionality, related to our skin color, related to culturally the spaces that we've grown up in. So being vulnerable with one another to talk about that and then see the ways that our stories overlap and come together. So I think on that level, in terms of kind of writing and contributing to the literature that way, it's really about ourselves and being able to contribute to a literature that in many ways we didn't have access to, right? So for me, I think I see it that way. So when I read your articles, Ms. Yearwood, your articles, Dr. Walton and Dr. Corley, who wasn't here, I feel this sense of affirmation. And that's also receipts, right? So I think for me, as an associate professor, moving, trying to situate myself to make some more structural changes in terms of policy, in terms of hiring. I think a lot of it is about creating those spaces, bringing in more Black women scholars, supporting the PhD students who are Black women and non-binary persons that are really coming across and having to face this anti-Black racism in their programs.
Charla, I saw you go like this. I was like, what's that comment? Was that an amen?
It was such an amen, because I think I really just want to highlight for everyone, because I think, this work can feel really glamorous and like in vogue right now. But really what we're talking about is putting forth effort and work and having conversations that protect us, that keep us safe in the system. Because as we come to understand that, oh my gosh, when I read the article about health disparities for Black maternal health disparities, when I read that, I say, oh my gosh, those are racist hospital systems. But what I'm reading in the conclusion, when I'm reading how other people are talking about that, they're thinking, what must be wrong with the diets and health and well-being of Black women that they then die? Like, and I'm like, oh my gosh, nobody's saying that is like maintaining the idea of racism. Why is that? This is peer reviewed. How was this not? All the way back to the introduction, I think for a long time I felt really insecure, like that whole imposter syndrome stuff about doing this work, because I was like, I'm not doing something special. I'm just interpreting the information in a way that feels real for me, and having that conversation out loud, saying out loud that like, that's not how I read this information. That's not what that means to me. And sharing my perspective of just what my lived experience has given me, that's really the work. It has been a growing in understanding that that's not how everybody is perceiving the work. But that is really what we're challenging social work with, is like, is this the story we want to keep? Are we going to commit ourselves to this?
Yeah.
You guys don't see that this is fitting, like not fitting in with what you say you value and you align to. And that's the reckoning. That's the problem. That's the disconnect.
Let me ask this question that's coming to mind to me, right? Because we're talking about anti-Blackness. We know what that means, right? For us, right? Like, and we're nodding and hand, like if we were in person, I'd be like, yeah, right? But bringing it back because we're on screen. But like, how does anti-Blackness show up in the spaces that you are in, right? What does that look like? Is it a microaggression, right? Is it what does that look like in the spaces that you are in? So folks who are here with us today can understand that, because we get it. I feel like we're in conversation like, sis, I know, right? Exactly what you're saying, I get. But like, how can we articulate that for those who are in the audience? How does it show up?
So the way that I usually try to frame this for folks is that you need to go through a complete paradigm shift. We are not talking about benevolence to Black and Brown people. We are not talking about ways that men can be kinder to women. We are talking about a structural, systemic idea that maintains that what's right, what's good, what's normal, what's celebrated, what's to be rewarded is this really limited, narrow idea of what is a cisgender, white, heterosexual, able-bodied dude. Like, that is it. And anyone who exists outside of that is somehow deemed abnormal. That's the structure of this whole thing. And even in the ways that we practice social work, it maintains that structural idea. Right. And so if everything is doing that, we are maintaining the system that makes me somehow other and not normal. Why am I not normal? Why are you not normal? Only because you somehow don't exist to this really narrow standard of who the imagination of white men says that we have to be. That's not true, and that's not the only truth that can exist. The work is in figuring out and exploring and imagining who could we be, what else could we be, where could we go, what could society look like. But we can't even get to that project because we're labeling and diagnosing and treating and doing everything else to any deviation from this really narrow, limited idea of who someone needs to be. Because the only existence of where so much of what we know as unhealthy or not normal or whatever only exists because it doesn't play to the rules of capitalist patriarchy, racism, colonialism. That is the only reason why it is somehow a deviation. And that is in our science, that is in our research, that is in our practice. And that's the work that we are talking about when we're talking about dismantling white supremacy, dismantling these false ideas. And it's not about adding more people of color to our search committees. It's not.
Anything you want to add, Dr. Jackson?
Oh, do I? So first I want to challenge the idea that there are folks that don't know what anti-Black racism looks like.
Thank you for saying that.
These days, all you literally have to do is type in anti-Black racism in Google, and you will get articles. Heck, you might even get a cartoon image video of examples of what anti-Blackness looks like. So I'd like to push back on that, because I think in many ways when we are being asked to explain, asked to define, asked to relive our trauma, it is under this assumption that, you know, folks are, particularly white folks and non-Black folks, are incapable of, you know, understanding that information or gaining kind of awareness about that. So I'd like to push back on that. But I think it can be many things. So you mentioned microaggressions. I hate that term because they don't feel very micro. But those are exactly the things that when we got together, me and my co-authors, and we talked about what it looks like. So it is microaggressions. It is tokenism in the sense that you are seen as a diversity hire. You are there for face value to represent the school and check off the Black box. For Black women in particular, and I have it seen this necessarily with Black men in our profession, and particularly in academia, is this idea that you're in service of you're in service of students and faculty within the School of Social Work. So that means any kind of diversity efforts or things, you either got to start them, lead them, you know, or push for them. Because, you know, if you're not doing the work, no one's going to be doing the work. And
That's
so
right.
there's that double-edged sword, right? If you don't do it, nobody's going to do it. Me and my colleagues talk about this a lot, right? So there's that piece. It is seen in our policies, particularly around, I look at tenure, and that as a gatekeeping tool. Black women, marginalized folks from marginalized racial groups, the research that we engage in, the research that actually aligns more with social work, and what we do when we think about practice, is qualitative. So some of the methodologies that we use, and you spoke to this, Dr. Walton, and I want you to speak more to this, is this idea that the methods that we use, our community embeddedness, are seen as less than.
Yes.
This research, we talked about the disparities research where you're comparing, you know, Black women and, you know, other racial groups to the white norm. So that is a form of anti-Blackness that we experience. When we are told that our work is, not good, or when our colleagues, our white colleagues, co-opt our work and our experiences and our discussions around racism, right? So I think right now, particularly I see in schools of social work, this surface level admittance of systemic racism, you know, where folks will add a line or two in their articles that they're writing about something, acknowledging racism, but then aren't really willing to do the work. Or we love those statements that folks are putting out, but nowhere in their statement says what actions they're willing to take to dismantle racism. So again, you know, being present in these spaces, we talk about representation matters, but it comes in many ways at a cost, because you're constantly challenging and pushing back on things. And you mentioned this, Charla, that we assume that folks who are in social work are impassioned about, that are there to do the same things, when what you get is crickets. You get crickets, you get discomfort. And I think particularly for folks who are vulnerable, non-tenure track faculty, PhD students, you get retaliation. So I think just naming that, pointing that out, recognizing that these are all various forms of anti-Blackness that I've seen, that I've encountered personally, that I've seen other Black women, particularly dark-skinned Black women, students experience in their classrooms when they're asked to explain their experiences for all the white students in the room, and the professor themselves, because they don't get it. So again, I've seen it on all these various levels, and it's harmful.
It is. And painful, right? And painful. Because what folks come in thinking, particularly the students, if we're looking at that perspective right now, is to do some work that allow them to go out and change the system. But what we're really teaching them is how to operate within this system, right? Through silence in many ways. Because when they challenge it, then you become the problem student. When they challenge it, you become the student that no one wants to work with, or no one's wants to be on your dissertation committee, right? There's real consequences to it in the beginning, the middle, and the end. So if you're not the quiet person, that's the yes ma'am, yes sir type of student, or even assistant professor, right, junior colleague, then you're the one that's wrong. So everything that you hit on, Dr. Jackson and Ms. Yearwood, it is exactly what we're faced with, and it becomes exhausting. It's taxing. And we are tired. We are tired. We are tired. We are tired. I'm going to shift a little bit to some of the comments or some of the questions from the audience, because I want to make sure we get to as many as possible. Our first one asks, how do you all suggest that personal and professional evaluation take place as it relates to moving the needle on the progression of our profession?
So
I think that this is okay. I'm going to go with like, because at one time I believed all this stuff to be true. So I'm going to sound like I'm echoing a lot of like general social work knowledge, but it's going to have a twist. Okay, this is why supervision is important, right? But like y'all know this thing what happens in supervision. But ideally, this is what good supervision is for. This is why it's important for us to be also a part of our own learning and healing process as we are doing this work, because it is all tied together. And so I would suggest to be in community, to have conversations, to build relationships with diverse colleagues and people who you can have conversations and be doing an evaluation of your own practice. Where are you? Where are your biases? Are you actively doing the work? What are your values? Is what you're doing lining up with those values? Like, that's the work, that's the wrestling, that's the evaluation that we do to ensure that we are providing competent services. All of these things are right there in the Code of Ethics. It's what we were taught to do, but we don't do it from a positionality of understanding that all of the system is corrupt, and we are trying to work outside of it or trying to confront it. And so adding that element of power and privilege to understanding the things that are in the Code of Ethics might help.
Mm-hmm. 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 What are your thoughts? Dr. Jackson, were you going to say something? Oh, okay. Another attendee asked, what are your thoughts on the new CSWE standards as it relates to anti-racism? I saw your face.
Okay, before anybody like dives in and says terrible things about it, I was on the committee.
Oh, then let's say it.
So I feel, thank you, because I know you had to fight hard. I know you had to fight hard to get that in there, and folks have been fighting for decades to, I'm always looking at, these standards that we hold ourselves to in social work. And when they don't intentionally not include anti-racism until, again, after 2020, I just shake my head. So thank you so much for your labor. I could only imagine just how much work that was to even now, get that forward. And what I love about it is it helps me as an educator justify why I include content on anti-racism. Because I think the pushback and the challenge is very real, even in social work, with students, some students whose values do not align with our profession. So when you're talking to them about critical race theory, and their values say that that's not something that's real, as well as systemic racism, now I have justification, I have rationale, not that I should need it, but we do. I have justification, rationale for why we have to have that content, why we have to have those critical conversations. So for me, I am thankful. I think in many ways, I always get nervous when, they just kind of add it on at the end. So I think about how many Black people died in some ways for that standard, or for folks to recognize that that was something that was important to be added. So thank you again for that labor. But for me, it's a tool, and getting those statements out there that I can use as a way to justify the work that I do and why it's important to help future social workers be critical, understand systemic racism, and attempt to dismantle that.
That's right. Thank you. Charla, I always tell you, your work is the Lord's work, the Lord with the T work, because it's a different level of patience, right? To have to contend with this type of work. It's a labor, right? That you put yourself through to make sure that you're providing the right content, that you're providing critical thought around it, right? Like, it's a labor, and it doesn't stop, right? It doesn't stop in any way, shape, or form. It's
a labor, and this is probably not the healthiest thing, but listen, I will drag myself through fire to protect Black women. Yeah. So it's a labor that I do. If it allows for someone to add something to their syllabus or have a conversation in their classroom that they couldn't have otherwise, then whatever the labor was, it was worth it, because my intention is to protect and serve those folks who are most marginalized in our community.
Right.
And that means that sometimes I have to sit at a table and have an uncomfortable conversation.
But that's also part of the ethics, right? To work with the most oppressed, vulnerable, marginalized populations. But we're not gonna go there.
Yeah.
So let me go to the next question, okay? Because it's the disconnect. Could you, one audience member asked, could you speak more about the disparities with licensure exams?
So with the licensure exam, I think it is very similar to what we've been discussing about the paradigm shift. A lot of folks are like, okay, so for some reason, people who are older aren't doing as well on the test. For some reason, Black folks aren't doing as well as the test. What I would challenge most of our institutions, because the way that this is being addressed is like, let's support those people to do better. But by doing that, you are saying that those folks are not as competent. And you are putting no reason behind why those folks are not as competent other than their age or their race. So you are perpetuating the idea that their age or their race is the reason that they're not able to do this well. And that is what is problematic. That is what maintains the oppression. And so instead, why are we assuming that the test is good? We have absolutely, it's just like when listen, it's a little CBT. We have no evidence to support the fact that the test is good. We have no evidence to support the fact that people who pass the test are better clinicians than people who don't. We do have evidence that says there's no reason why two students, Black and white, should be in a classroom, learn information, and one of them not do as well on the test than the other for any reason that would be based on their race. We know that that doesn't match. So why are we drawing the conclusions that we're drawing? I love it. Bring a baby into space. That's feminist. Okay. No. That's how women work. So like, I really want to push folks to just think about the ways that they're drawing conclusions, because what we're doing is we're maintaining a system that really was only, it's a group of probably well-intentioned, but because the majority of social work is white women, it's white women designing a test that affirms their way of practice and their worldview. And when non-white women take that test, they're not doing well. Can we look at the bias of the test? No, apparently we can't. We have to accept it as it is and say that it's an issue of those folks who are taking the test. That's the issue with the licensure exam. That's why we're doing that. And if we're going to examine the test, I encourage social work to examine, why are we playing the game of professionalization? Why are we trying to fit closer into the ivory tower? What are we actually saying that we're committed to? There are so many other questions that we could actually be having a conversation about. But again, our institution is going further into these conservative ideas, and we're not actually wrestling with decolonializing our profession, like healing the things that we say that we care about. Yeah, that's something that really, that's a big one for me.
Yeah, thank you for sharing that very much. There's a question that I'm excited to read from a BSW student who said their classes have been very disappointing in regard of what we've been talking about. And they want to know what solutions will look like for them at the BSW level.
I'm just doing a big exhale here. So first of all, thank you so much for posing that question, and recognizing also how difficult it can be in those spaces when the topic of race, the topic of anti-Blackness is not being had, or when it is, it's done in ways that are very surface level, doesn't get at the root, and as Charla was mentioning, blames Black people, Black women for the problems that they experience. So I think what I experienced, if I can think back that far, when I was a BSW student, and what I noticed with BSW students now is the need to connect with other Black students, Black women in their classes, as well as faculty, if you have access to them. But I think in many ways, kind of that mentorship relationship has been something that I think students eventually get to a place where they have to seek out just for their own survival, to be able to talk with another person about their experiences and have them affirmed versus, continuing to feel otherized is a huge part of that. And to take care of yourself. And I think that's something that you step into these classrooms and it's exhausting. So you're facing some of the same kind of battles that we face in different committees, and trying to get a standard added after all this time to focus on anti-racism. So it's exhausting. So some of the things we talked about, me and my co-authors talked about in our article, was this idea of picking and choosing our battles. And so this idea of challenging our profession, a professor, or bringing up issues of race and racism, decide when you are emotionally in a state to be able to do that, but also protect yourself, because sometimes it's not safe to speak out about race and racism. And that's when those relationships are so important. So to be able to kind of run it by other folks who feel very similar, share your values and your perspectives. So that's kind of where my first thought went to.
And echoing what Dr. Jackson said in terms of protecting yourself, it's okay to leave a classroom when you feel uncomfortable, right? It's okay to leave a space when you feel like you are not welcomed. It's okay to report that, right? So protecting yourself means a number of things, and having support around you to help carry you through that is vitally important. And mentorship has been the biggest part of my career path, more than anything else, and connection with other Black women when instances of anti-Blackness show up in my work, and work specifically when it comes to faculty meetings, to committee meetings, right, to passings in the hallways, interactions with students, right? So connection and being able to walk away is vitally important. And no is a complete sentence. Know that. You do not have to, no is a complete sentence, period. So off my soapbox now, sorry. The other question we have is, I've recently argued that an alternative, more just method of criminal justice is social workers providing oversight of police agencies. If social work is behind, what is a workable alternative means of criminal justice reform?
So I'm an abolitionist. Yeah. My personal, and because abolition is not just for me a professional idea, it's a faith-based idea. It is very deep for me. I don't think that we inherently need a system of policing. So what I would encourage and suggest is that we go about the project of imagining a new way. I think imagination, dreaming, thinking about, I think that is already such a confrontation to the structure and systems as they are, just to imagine what else could be possible. And so I guess I support, and I'm supportive of the idea of imagining a new way, but I would caution us as we imagine new ways if we are just perpetuating exactly what it is that we are trying to respond to. And it would be my argument that by working with police, we would be affirming their role in the community. And I think that their role in the community is inherently problematic and inherently anti-racist and patriarchal and colonialist. Yeah.
I would just add that Dr. Walton, your university, your department had an interesting interview with Dorothy Roberts about this very question. So I think before we argue a particular point of view, I think it's really important to kind of, read about, listen about, understand more about the issue, because it's a lot larger than, just what stance can we take in terms of criminal justice reform. So yeah, I would advise someone to kind of watch that video. I thought that was very well done in terms of asking those critical questions about the role of social workers in criminal justice as well as child welfare.
The link was just put into the chat for anyone who wants it. So please feel free to look at that. Another question is, in my university, I am having trouble explaining the distinction between whiteness and racism. How might this begin to be unpacked?
Okay, so I would start answering that question with, is that a role, before you move forward, anyone who's in that situation, is that the role and position that you want to play in the institution? That is going about helping the institution heal from, wrestle with, do all this work that they might not actually be invested in doing. And so it's similar to like helping a client through a healing process that they're not actually invested in, like in that area. Like that's not a treatment goal for them. That's a treatment goal for you. And so then you're just like banging your head against the wall because that's not what they want. And self-determination, all of those things. So before even embarking on that work, I would say do some evaluation of if the institution that you're at actually wants to do that work of understanding the difference in the ways that whiteness and racism play a part in the institution. Because if they're not interested in it, you are just putting a target on yourself, and it can be a dangerous situation. I worked for an institution before. I don't anymore. So do that work cautiously. Now, once you're doing that, if you want suggestions for how I go about having those conversations, I try to use a lot of the clinical skills, getting them to understand themselves in relationship to other people, getting white folks to understand themselves in relationship to other communities and other cultures, how they may have normalized whiteness as normal, calling those things out, naming it, not in a confrontation, but in a way that really speaks truth to how things are, and forcing them to be in confrontation with that. Those things have been most helpful for me. But again, doing that work, you're probably not going to be getting paid for that. And that is a consultation job that somebody else can do for a fee, and they can pay to have all that work. Putting that whole responsibility on your back and doing that for an institution that is not invested in that work is really like lighting yourself on fire. Not that it's not noble and great and beautiful. If they don't want it, they don't want it. And there's no point in putting yourself in that position.
Thank you for saying that, right? Because I think oftentimes faculty members, and particularly faculty members of color, and more narrowly women of color, and even more narrowly Black women, take on these additional roles because this is my job, right? But we take it on without getting paid, right, for our worth, right? And so making sure we create those boundaries are vitally important. And again, no is a complete sentence. And it's all, no, I cannot do this now, but here's as Charla have shared, a consulting firm, group, individual that can do that work for us, because the lift is massive. And that takes away from, if you're staying in the institution, which segues into our next question, from your time for your research, teaching, service, right, mentoring, and everything else that comes along with the job. So how do you create those boundaries and foster safety and protection for yourself? One of our audience members, Dr. Campbell, shared, how does this all apply to this idea of opting out, right? Where we say that people are leaving these systems and not playing the game, but how in many ways we as Black women don't have the luxury of opting out, because to do so really impacts our health and well-being. What does opting out look like for us? I'm currently opting out to take care of my health due to the work, but had to leave my job to do so. How can we opt out without suffering very real challenges? That's real. That's real, and that's heavy, because folks are getting sick in these spaces, right? I always tell my students, particularly doc students who want to work over the break, I was like, I don't work over the break, I know there's consequences to that. And I expect you not to work over the break for anything that you're doing with me. You deserve rest. But I know there's consequences with that when there's faculty members that's telling them you need 10 publications before you graduate to be competitive on the market. Right? The narratives that we're creating are definitely making people sick. Right? And when we opt out, in many ways, we're opting out maybe for protection and for health, but in some ways missing the opportunity to serve as a mentor for those like the BSW student who asked that question, who needs the connection, right? There's consequences in both staying in and opting out, but I would love to hear what our panelists have to say.
I just want to applaud, I believe it was Dr. Campbell, who mentioned, taking this time. I'm needing to opt out. I got to step away, focus on my health. You're doing it. So I think that's how we do it. That we take that time, we acknowledge that time, and when we step away. My colleagues and I, we talk about passing the torch. Like, look, I put in the fight. I'm going to hand the torch to you. I will step up when I'm able to, again, continue in the fight. I do want to acknowledge, because I think it's in some ways, it's a privilege to have choice to do this work and not do this work. So, I have white colleagues who are, always telling me, well, maybe don't do that. You don't have to lead the diversity work, or you don't have to focus on anti-Blackness, or you don't have to. And for me, it doesn't really feel like a choice. This is in many ways, inherent to who I am, what I've been doing. And also I can't help but challenge systems that are oppressive. So for me, I think acknowledging, accepting in some ways that, doing this work is difficult, and putting in kind of ways to step away, like Dr. Walton said, support one another, finding your community of folks that will call you out when you're putting in too much time, you're doing too much, you're not getting enough sleep. So having a support system in place, I think, has been something for myself that I haven't found. I didn't find until, I'm in my 40s now, and, now I have that community. But I think that's something people need to establish, early on in their career, because this is difficult work. But yeah, I'll turn it over to the other folks.
I would echo what you said. Community is so important in this work, of just like having people around you so that they can support you and help you to do. I always use the example of like the Montgomery bus boycott. When that happened, that's only able to be successful because other people are chauffeuring people around, driving people to things, doing those things. So we have to have community, because the only way we're going to get through confronting these systems existing outside of it, all of those things, is through mutual aid. We're going to have community. We're going to have to be able to support each other through the process. And that could look lots of different ways, but that's the only way that we're going to be able to make it happen. I practice acceptance and commitment therapy. So, I think we have to grieve the real reality that in order to choose what's safest for ourselves often means that we're going to have to deal with consequences on the back end. There isn't a non-consequence option for many of us. There's a consequence one way or the other, and then we make the choices based on how safe we feel to be confrontational in the system. But I don't know that there's a perfect answer or a safety available for us.
Thank you for those responses, because I think it's something I wrestle with every day. Do I stay or do I go, right? And what does that mean? And what does that look like? And what's the consequences of both staying and leaving? And so maybe I'm becoming a little bit more radical in my approaches and how I do the work and how I engage with students to make sure they're healthy in this process. So thank you for those responses. Another attendee asked, what's your go-to resource for white allies? They shared Beyond Ally Pursuit, Racial Justice. It's a book. The pursuit of racial justice, I'm sorry, beyond ally, the pursuit of racial justice.
So my go-to is the Seeing White podcast series. My go-to, if someone asks me where to start, I say do the Seeing White podcast series. It is put on by Scene on Radio. It really just covers the history of whiteness, and I think it helps to reshape how you see racism as not an issue or problem of, it's not an issue or problem of any Black or brown person. It is an issue of whiteness that causes harm. And I think by understanding that, you can look for ways to help whiteness heal from itself and release the rest of us.
So I don't give kind of resources anymore. I think in some ways I push back, and particularly if someone is claiming to be a white ally. I think I ask them what work they've already done or is willing to do to figure out what those resources might be for them. Because you're not going to become a white ally after reading a book.
That's right.
Watching that, listening to that podcast, which I love, by the way, and is a must listen to. I'm thinking about, and maybe you guys, you both could also kind of think about, I'm thinking about the number of true white allies that I have encountered through my career in academia and social work. And I'm thinking about folks that are consistently in the battle, shoulder to shoulder.
Right.
You mentioned the bus boycotts, the folks that are willing to go down, give up power, and fight for this work. And I'm not sure I can say I got, on one hand maybe of folks that have been willing and able to do that work. So I think for me, wanting to see that effort, what have you been willing to do? What have you done already? How are you critically examining yourself and your own participation in white supremacy? I've had to do that work as a light-skinned, person raised with a white mother. That's work, and it's continuously ongoing. So what work have you done? What work are you willing to do to take on that mantle of allyship? And again, I have not seen many folks that have stood up to that, that bar.
Dr. Jackson, I'm just gonna go, okay?
Yeah, can I just say, that is so true and so heavy, because what I'm hearing you say is a call to actually begin doing work, not consuming information, so that maybe you have enough knowledge to be able to perform anti-racist. But anti-racism isn't a performance. It isn't did I say the right thing? Did I do the right thing in this situation? How are we supposed to have this class? It's not like a performance. It is an in your soul wrestle with, what do I believe to be true?
Yeah.
How am I conceptualizing the whole world? And how am I unpacking that and understanding, is it the only way that things could be? Are there other options available? That's the work. And people are looking for information so they can perform it better. They're not actually looking to understand themselves and how they're perpetuating whiteness.
And I also think the other piece is, are you challenging folks when they say something that is racist, that is anti-Black, that is sexist, that is not from a book, but like you said, from the depths of your soul, that they're wrong about, right? Are you challenging them and maybe in a loving way? Some you just may have to ignore, but are you challenging them to help them think through something differently? I always go back to, and not to offend anyone or bring politics into this, but I always go back to when the past president Barack Obama always gave a story about how he wanted someone to buy into a position or to a policy or to his mission, right? Those stories were very captivating. Those stories for me, as I think about a constituent who had to select someone for president, was valuable, because it told me more about the policy and the commitment. And if someone were to benefit from it, what does that look like, right? Allyship is not performative. Allyship is, can you tell the story about how your coworker or that student was impacted by a racist comment, right? That someone said either in the faculty meeting or during a presentation that was done, and you stop them and you allow that to be a teachable moment, and you use that space, right, for growth and knowledge and to wrestle with it. Allyship is about being uncomfortable, right? Where's that discomfort at for you to be able to speak up? I can go on, but like, where's that at?
If I could, one more example here. So for myself, as a cisgender woman, I have had to do some exploration and understanding and unlearning about gender so that I can be more inclusive to understand my trans sisters who are also having to deal with all the things that patriarchy brings to the world. And so in doing that, the majority of my work has actually been me understanding my own gender, me understanding myself as someone who, as I get older, grows whiskers that I gotta pluck out of my chin. It is understanding and exploring and accepting that as part of my womanhood that I begin to understand and like be able to be more inclusive of who they are, because I understand them as me. The work is not about me trying to understand trans people because I need to like know their storyline. So that's not what's going to allow me to be more inclusive. What's going to allow me to be more inclusive is for me to explore the boundaries of my own femininity so that I can expand that they might also, so that I might also understand their femininity so that I am not doing something that harms or discludes, like leaves them out because I can't accept that is also part of womanhood. I hope that lands for the people who need it, but yeah.
Absolutely. I recognize our time and we still have a ton of questions in our live chat, and I'm sorry that we can't get to all of the questions, but just a few more before we do some wrapping up. How do we deal as a Brown professor in academia, knowing desperately this work is about survival, but my white colleagues are requesting we help them understand? I do not want to, period. But what happens to those students is the question. I can see it, right? Like in the face of Charla, of Kelly, like I see it, like it's a lot. And I think the piece that we keep coming back to, not only is it a lot exhausting or taxing, the labor that we have to do in these spaces that initially was never designed for us to be in. The labor that we have to do to be able to show up to work sometimes. Because we know, like, if I were to die tomorrow, I'll get flowers sent to my funeral in a car and my tenure line will be open next year, right? Like the labor we have to do. So how do we show up is vitally important when we come into the spaces. The labor is critical. And sometimes it cannot be about everyone else. Sometimes it just has to be about you. How do you prioritize you? How do you protect you, right? How do you value you in these spaces? It's a lot. It's a lot. The layers goes deeper than intersectionality. It's historical, it's political, it's social, it's cultural, right? Like we can go on and on. We live in and through the depths of our intersectionality every day, every day.
Dr. Jackson mentioned earlier also the ways that then your writing has to be presented in a way that can be accepted by the Academy. So I think I want to speak to the fact that I want everyone everyone listening to understand the layers of work that Black and Brown folks are doing to just do the work. We have to know the information, and then we have to translate it into whiteness so that we can present it in a way that whiteness will deem acceptable and believe it to be true, so that maybe possibly we can get the runoff effects back for our community. And it's that layers of work that goes into every email, every conversation, is that you have to ensure that the way you're communicating the information is being translated through whiteness so that it will not say that's a lie, that's wrong,
That's right.
that's false.
That's
Like
right.
we have to translate the work first, and it's an extra added layer. But also, like, we can't save everybody, and
That's
like
right.
I will drag myself through the fire for Black women, and all I can do is try to create a path. Unfortunately, in this system, I cannot go back and get everybody. I cannot walk everybody through it. I can create space so that hopefully those who come behind me cannot have to deal with as much, but I cannot do the work of supporting each person through all the effects of all the things that they're going to have to experience, not because I don't care, but because then we will both get eaten. We will both get eaten.
Mm-hmm.
And so I think that that's part of the grief work that we have to do, is accepting that I can't. We're not all going to, you know, if I see someone over here who's saying something at their job and they're speaking up about social justice issues, and they're right, but like if I say that over here, then I'm going to lose my job, and then my family's not going to be able to eat. And like I can like give them kudos very quietly, because that's all I can do. Like that's just real. That's just real.
Mm-hmm. 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 One question, two parts, because we have 5 minutes left. One person asked, how do you take care of yourselves in this? And then my follow-up is, what do you hope for us in these spaces, for the work that we're doing, for the conversation around anti-Blackness? What do you hope for? And how do you take care of yourselves?
I'll answer the second part of that. I'm still taking in what you said, Miss Yearwood, just about, it just resonated with me that we can't do it all, right?
Mm-hmm.
And we have to just sit in that and recognize that. So yeah, still there. I think for what I'm hoping for, and I'm very appreciative of Affilia for, you know, publishing work that speaks to these issues, for hosting a forum that in its title says anti-Blackness, because we need more spaces like this.
Yeah.
We need more opportunities to come together. You know, folks might be laughing, watching us nod our heads and, you know, raise our hands. But there's something to, you know, when you're in spaces where your identity is not affirmed, when your experiences are not recognized or are intentionally disregarded, that when you come into these spaces and you find folks that are going through the same things or similar things that you are, that there is a healing around that.
Mm-hmm.
So I'm constantly texting my close friends, you know, did I just see this? Did I miss something? Like, this is to get that affirmation. We need that place, but we need those opportunities in our knowledge base and in literature and in our research. So wanting to see more journals publishing work in this area, and not, again, using them as gatekeeping tools, which is something that I have found. And Charla, when you mentioned that about the intentionality that has to go into each email, well, think about how much intentionality has to go into publishing a paper that's so personally connected to your own trauma. Right? To be able to do that work and then come across some very white-centric, very post-positivism and positivistic kind of views of what is good research and what is unbiased, you know, evidence, to have to justify at every turn your existence, the importance of this topic. It's a lot. So needing more spaces, more opportunities. We can't just resort to special issues. So I'm so appreciative of your special issue, Ms. Yearwood. This idea that we can kind of push it off right? Or we have a journal on racial and cultural diversity, and you could try to publish in there, but none of your colleagues see that as a relevant, high impact journal. Again, all of these different barriers that we face in the system. We got to start having more and creating more spaces. And there's so few of us. My co-author, Dr. Gina Miranda Samuels, is now a full professor, right? And so what comes with that is having more opportunities to, again, help more of us get through and be in these circles of more power, more influence on curricula, more influence on policy. So needing more of us in these positions of power to kind of help us open and create these counter spaces for one another.
Thank you. Charla, anything you want to add?
I would just say I'm really lucky to have a family who helps pull me out of the weeds, and I can go like actually play with my kids and put the rest of this stuff down, because at the end of the day, like I'm building a little mini community at my home, and I'm focused on making sure that that one is equitable as much as possible. The rest of it can be. But my hope in general my hope in my work right now is to try to make sure that the message gets out there and is very clear for the next generation of girls like me who go to an MSW program, who believe that it's going to be all the social justice stuff, and gets in there and feels like, wait, maybe I'm not in the right place. Maybe I'm thinking about this wrong. Maybe I'm conceptualizing this information in a wrong way. Maybe I'm not as smart as everybody else in the room because I'm not coming to the same conclusions as them. I want to make sure that she knows that, like, no, other people were thinking that way too.
Yeah. We are at time, and I know given the questions that have been coming in, we still have more to go through, and I'm sorry that we couldn't get through everyone's questions, but I want to thank our brilliant and passionate and available and honest panelists for being in conversation with me and everyone else in the audience, because I think these are the spaces that we continuously need, and trying to figure out how can we forge a path that allows us to show up authentically as ourselves is vitally important. And so you all shared some really good thoughts, not only in terms of your work, but also in terms of your passion, and it's greatly appreciated. So thank you for showing up and being in this space together today. Thank you to our audience members for being able to be a part of this discussion and really being in tuned and asking the questions and pushing us to think more. If we have more time, I know we will keep going for hours on end. And thank you to our sponsors for the time for the webinar, because it's truly, we would not have been able to do it without them contributing the time, the webinar, everything to this. And thank you to Affilia for being thoughtful enough for this type of conversation to happen, because if it didn't come from you all, we don't know when our paths would have crossed in another way. So thank you for that opportunity for us to come together. And just an FYI, everyone who registered for this webinar will receive the recording as well as the resources listed. And so we are grateful for you all to be here with us today. Take good care, have a safe and joyful holiday season, and please come to our next Affilia Critical Feminist webinar in the new year. Take good care, everyone. Take care. Bye.